Hello and welcome to today's next interesting session, something that we get asked about so many times. It's when you're worried that your multilingual child is late talking, a speech and language therapy perspective. And I'm so delighted to welcome Dr. Mary Pat O'Malley to tonight's session, and she will speak about this for you and will answer your questions at the end. So Mary Pat O'Malley is a speech and language therapist and lecturer with over 25 years of experience of working with families. She's passionate about helping speech and language therapists to carry out best practices with multilingual families and about supporting multilingual families to develop all their child's languages using evidence-based strategies. She's involved in a range of research projects aiming to improve speech and language therapy services for multilingual families. She's co-authored our guide for parents, how to raise a bilingual child, and she's also a speech ambassador. Together with Nadia Hökner, speech and language therapist and founder of Language Families, she has created the Becoming Bilingual Facebook group to support multilingual parents. Her first book, Multilingual Children, How to Develop All the Languages They Need and What to Do When You're Worried, will be published in January 2022. Welcome, Mary Pat. Happy to have you here.
Thank you very much, Rita. Delighted to be here, and hello to everyone. I just have my phone beside me here, so I'll keep an eye on the time because I'm aware of everyone's time. So let's get started.
We will take the questions at the end, so please put them in the Q&A, and we will try to, or we should finish like 16 minutes to full hour.
Okay,
thank you.
Perfect. Thank you.
Yours. Thank you.
Okay, so I thought first of all I'd start with a little bit about who are speech and language therapists and what is it that we do, because often people aren't really sure. And one issue is that we have many names depending on where you find us. So for example, I'm based in Ireland, and in Ireland, in the UK, we're called speech and language therapists. Whereas in America and Canada, in North America and Canada, we're called speech and language pathologists. Australia say speech pathologists. Speech and language therapists is the term in New Zealand. And then I've asked around for people from other countries to see what are the names, and you see them there, like logopedist, pardon for my pronunciation, orthophonist, and I'm sure there are more. But essentially, in terms of what it is that we do, we study, diagnose, and treat people who have communication disorders. And that is a very broad-ranging kind of term, really, because it includes people from, we say, working with babies, for example, who are born prematurely and have difficulty feeding, all the way through to, let's say, for example, people with dementia or people who've had a stroke. So we work with people across the lifespan who have difficulties with understanding language, with using language, with reading and writing, with social skills, people who stutter, people who have got voice problems, and obviously people who are multilingual can have any of these difficulties. So speech and language therapy really covers a multitude, and for many practitioners would say, depending again on where you are, feeding, eating, drinking, and swallowing also comes under the remit of the job of the speech and language therapist. And we work with people who have difficulty communicating. Either something emerges in the course of the child's development, so they're slow to talk or late to talk, and I'll talk a bit more about that later, or they have a stutter, or they have, let's say, a learning disability, or they have a brain injury, cerebral palsy, or they have hearing loss. There's a vast range of conditions that can affect communication, and lots of different kind of problems that can emerge over time as well. We also help people, as I said, who experience difficulties with swallowing, and that's from Speech Pathology Australia, the professional body. Generally, speech and language therapists, let's say in Ireland, in terms of qualifications, it's an undergraduate degree that takes 4 years. There is a postgraduate option, which would be 2 calendar years. And then once you've done the degree, you can register with the statutory body, which gives you the right to call yourself a speech and language therapist. So the professional bodies have different kind of information. I thought it'd be good to look at one about what is our role with bilingual or multilingual families. And this is from the Royal College of Speech and Language Therapists for the UK. And basically, one of the things that we do is we look at, is there a problem? So does the child have, let's say, a delay? Are they late to talk? Is their vocabulary restricted? Or is it an issue that they have had one language at home until they've started school and they're being educated in another language? Let's say in Ireland would be maybe the community language, and they don't have a problem. They just have, they need more time or more exposure to the community language in order to use it and understand it kind of with greater proficiency as time goes on. So we have to distinguish. This is what they say in the literature. They call it difference versus disorder. So that's one of our roles. And then the other role is that for the speech and language therapist is to provide all aspects of the care pathway. So a child, I'm going to focus on children obviously for this, is referred to speech and language therapy. And how you get referred depends on where you live. So for example, in Ireland, you can refer yourself to your local services. You don't have to wait for a referral from the GP or the public health nurse or a health visitor, I think they're called in the UK. So you can refer yourself, and then the speech and language therapist basically addresses speech, language and communication issues and feeding and swallowing disorders. And the RCSLT specify in the home language. The current thinking in terms of the best practice recommendations across the professional bodies is bilingual children need bilingual assessment and bilingual intervention. Continuing on then, about our role is to advise parents, carers and the multi-professional team on bilingualism. I've done some sessions recently with teachers on how to support multilingual children in the classroom. I've done cultural awareness training with speech and language therapists and social workers recently as well. So that's another kind of aspect to our role. The RCSLT also say that we have a role in explaining or discussing with parents the consequences of abandoning the home language in favor of the majority language. So again, these are kind of the best practice guidelines as well, that we would never, the professional bodies say never to suggest the dropping of a home language in favor of the majority language. And then the role further up kind of then would be in terms of the leaders, like managers who are involved in designing services, would be to make sure that the services are designed so that we can actually follow through on the best practice guidelines. Because we know, for example, that if the child speaks 2 languages, we'll say they need to be assessed in both of their languages. And one of the challenges is that will mean the system will need to give more time to the therapist to do that properly, and will also need to make time for the therapist to work with an interpreter if that's needed. And if you're working with an interpreter, that's going to take more time because you need to talk to them before the session about what you want to do. Then there's going to be the session, and then you need to talk to them afterwards about what happened and observations about the child, we say, for instance. So there are constraints that we're operating against in the system, particularly in relation to time. So there's a kind of a political aspect there as well in terms of managers advocating for that. And another kind of challenge, I suppose, for the speech and language therapists as well is in relation to assessment and what measures are available to us to assess multilingual children. And I'm going to talk to you now about kind of the options that we do actually have. There is an organization called the International Association of Logopedics and Phoniatrics. I have a list of resources at the end of the slides, and you can get the link. And they have some very useful documents about questions that parents ask about speech and language therapy. But they also have a very good document for speech and language therapists, and that just came out last year. And they say that if we're thinking about assessment, we need to think about what is the point of it, what's the purpose of it. And these are the things we can do. So, for example, I'm going to start actually, ironically, one thing we're not supposed to do is this use of standardized tests. So we have tests that we use with monolingual English speaking children, for example, tests of vocabulary. So you might have 4 pictures and you say, I'm going to say a word, and can you show me the picture that goes with the word? So testing receptive vocabulary. And the problem with those tests in relation to the multilingual children is that they're not designed with multilingual children in mind. They're designed with monolingual children, and norms are devised with monolingual children. So the recommendation is not to use those. They do say you could use them and then look at, rather than scoring the test, you just look at how did the child perform and what items did they get correct and what items did they have difficulty with. And if you gave them some kind of help, like clues, how were they able to use the clues to improve performance? But they are really not recommended. Translating tests isn't recommended either because, as we know, languages operate differently. So you can't map one language onto another in terms of the testing. Other things we can do, though, looking at number 5 there, would be parental questionnaires, and there are definitely ones available where the therapist can talk to parents around who's using what languages, the age at which the child was started hearing those languages, their opportunities to use them, their motivation, what do they need the languages for example. We can use interviewing techniques to really explore the meaning of the languages for the family, and that's really important. And number 2 there, then parent-child comparative analysis. There isn't a lot of research on it. It's a shame because I think it's really interesting. And this is where you would administer a series of tests with the parent, let's say, for instance, and then you would administer the same test with the child. And then you would look at where the child and the parent differ and see, you can do this with pronunciation, for example, where looking at the adult's pronunciation, the child's pronunciation, and see where there's a difference, and then discuss with the parent, oh, is that what you might expect a child of that age to say, and really work collaboratively with the parents. Number 3 there then are called language processing tasks. Those are things like where we would have sentences and you would read the sentence, or the child would listen to the sentence through earphones and they repeat the sentence. Or non-words or nonsense words is another version of this language processing tasks, which tend not to be not making a generalization here, but not affected by exposure to language. Narrative assessment, so storytelling is another option for us, and that is considered, if you think of stories in terms of big components like story grammar, so like characters, a problem to solve, a beginning, a middle, and an end, the emotions of the characters, for example, those aspects of narrative or stories tend not to be affected by exposure to language, so they can be very useful for us during assessment. And then dynamic assessment is where we look at if we give the child prompts like repeating an instruction or breaking down the instruction, can they make use of that information to learn? Because again, that's looking at their ability to learn and to modify things rather than what do they know about in a particular language at a particular point in time. So other options then that we can use. So these are things that you can watch out for if you are going for speech and language therapy. Is this kind of thing happening? So the World Health Organization have this document called the International Classification of Functioning and Disability. And that looks at, for example, activities and participation is basically looking at what do children need their languages for? What do they need them to be able to do in their lives? So do they need them for, let's say, school or for extracurricular activities or for connecting with extended family members, for example? Are there barriers to participating in, let's say, the classroom because it's not a language-friendly classroom or it doesn't have visual kind of schedules to help them follow what's going on, for instance? Environmental factors, then we can look at what are the attitudes of people around them to being multilingual, for instance, and personal factors then would be looking at how many languages do they need, what are the current uses, the future uses, that kind of idea. So that gives a culturally sensitive framework for the speech and language therapist. Then another option is from Lirong Lily Cheng, and she calls this the RIOT approach. It's review, interview, observe, and test. So review is where we look at any documentation or reports that have been written about the child. Interview with, say, the family, talk to teachers or other relevant professionals, observe the child in a range of contexts. So it might be like a school visit. Obviously, things are kind of different now with COVID, but it could be a home visit, a school visit, a meeting in the playground, for instance. So we see how they are in different situations and with different people. And then the testing is only like one component. And I've kind of talked about that. So moving closer to the children who relate to talk, but we do need to think about, Catherine Conert is an American speech and language pathologist and researcher in the area. And she talks about these 3 things that we must remember about language development in multilingual children. And one is individual variation. Now, for children who are late to talk and for early language development, there is a significant amount of individual variation anyway. And for the multilingual children, she talks about the 3 Ps, so people, places, and purposes. So we speak our different languages with different people in different places, like at home, at school, the playground, for different purposes. So for relationships, for education, for religion, for example. And because you'll have, let's say, 2 or 3 different languages and these 3 variations or varying situations here, that leads to significant individual variation. So if you think of speech and language therapy for monolingual children, we talk about norms and kind of, the average range. But norms are a problematic concept really in relation to multilingual children because of this individual variation and heterogeneity in the population. I think that's a good thing because it means there's no such thing as one size fits all. Another thing we need to think about is how the languages influence each other. So again, there's lots of research on this, and there's, positive influences, negative influences, but just that the therapist is aware that influences happen. And if we're talking about difference versus disorder, we need to know about this so that we don't misinterpret something we're seeing as a sign of a problem when actually it's just a sign of the languages influencing each other. And then the distributed skills and uneven abilities is that, let's say, for example, if I'm thinking of a preschooler, so they have home vocabulary in one language, let's say, for instance, and then they go to school in a different language and they're acquiring concepts and vocabulary to do with academic purposes in school. So you get variation across the vocabulary at different points in time, or let's say they may be good at storytelling in the home language and not yet in the school language. So we need to bear that in mind in terms of what task are we asking children to do and all the background information about the languages and the amount of exposure that they have. So I'm not going to spend too long on the influences about what's in the mix, because when we're assessing children, we also need to think about these things. So for example, are the languages belonging to a similar language family, or are they very different? Because that may influence. So for example, if we think about, I'm just thinking of Irish and English. So we need to think about, okay, the grammar of English, let's say the subject, the verb, and the object, whereas in Irish sentences, the verb comes first. So we need to think about, is that why something is happening, or I'm seeing something in the language? Or is word order in one language very fixed and not so fixed in the other? So it might explain, let's say, if you're thinking of Russian and English, so word order in English is quite fixed, not so much in Russian. So if I'm seeing word order in English that I think, that seems concerning to me, I might think, I need to find out more about Russian and see, is it the influence? The status of the languages where you live will influence language development as well, for example. Okay, so I've set the scene, I think, really in terms of who we are, what we do. Where you find us, again, depends. So in Ireland, it would be in health centres, maybe in schools. In the States, for example, a lot more work happens where the speech therapist is actually based in schools or goes to schools. In Ireland, it still seems to be quite clinic-based. And obviously there's teletherapy at the moment as well. So if you think, my child isn't talking, what should I do? An important thing, I suppose, to remember is, even though this myth is still unfortunately out there, is that being multilingual doesn't cause delays, and most children develop their speech and language, it proceeds without difficulty. So often we think about, there's a lot of talk about, have they started talking yet? What have they said their first word? But before our first words, really, there are some critical foundations that we need to consider. And this concept is called, the fancy word is intentionality, but this is basically so when babies are born, they communicate, it's reflexive communication. So they're vocalizing, they're making sounds, and we interpret what they're saying and layer meaning onto it. And then gradually over time, they develop what's called intentionality, and that's where they mean to send a message. And initially they do it non-verbally. So for example, these are called communication intentions. Pre-verbal means just before they're actually using words. So it's things like, for example, shaking their head. This would be, again, this gestures are cultural. I'm going to talk about those shortly as well. But in Ireland, let's say a child shaking their head would be the no. So that would be like a rejecting something or a protesting. Rejecting might be pushing the thing away and like a facial expression to go with it. Pointing to indicate I want that. Raising their hands to be lifted up. So you can see there, they're clearly signaling, I want to cause an effect here. I want you to do something. I want you to stop doing something. I want you to share something with me. Greeting, for example, is another communicative intention. So before they start talking, they start communicating. So I think it's good to look at, if you think, oh, they're not talking, look at how are they communicating? What do they like to talk about? What are they or communicate about? What are they interested in playing with, let's say, for example, and look at what are they doing rather than focusing on, let's say, that they're not using words first. So that's the intentional communication that we need to think about. And then there are gestures as well. And gestures are important for language development. Now, there's a really good website, and again, I have the list at the end of the presentation, or the link at the end of the presentation. An American researcher called Amy Weatherby and the First Words Project, and there's a series called the 16 by 16. Now, I would say that it does seem there is different language, a couple of different language versions, I think, on it, but again, in relation to gestures, we need to remember the cultural aspects of gestures and how they're going to vary from culture to culture. So there is a PDF there with the 16 gestures that children would be expected to be using by 16 months. I'm not a fan of like 16 by 16 or by 12 months. They should be doing this. We need to be kind of more flexible and go around about or ish because of the individual variation. And so she lists the 16 gestures that would be expected by 16 months. It can be useful for thinking, okay, what kinds of things is my child doing and what might I focus on working into my own communication with them? So basically what she says is that the research shows that the development of gestures from 9 to 16 months does predict language ability 2 years later. And that's important because preschool language skills predict academic success. It's also important to remember, I think, what's true for groups of children in research isn't necessarily true for the individual. So we need, again, to be, cognizant of that. But she says anyway that by 16 months, children should have at least 16 gestures, and between 9 and 16 months, they would be expected to developing at least 2 new gestures each month. Just to give you some examples, and again, this is more than likely from like a white Western cultural orientation, would be giving an object. So reaching their hand out to give an object, shaking their head. At 10 months, maybe reaching for an object or raising their arms to be picked up. The general point is just to think about gestures really and observe, do you use gestures yourself a lot? Does your child use them? Do you think it would be useful to kind of weave them in, but to be aware that before the first words emerge, there's a lot going on from a communication point of view. When do first words emerge? It depends on where you read or what you read. So some papers talk about 8 months, and then others go up as far as 15 months before the first words emerge. And then, so that's kind of, the ballpark figure. And then we think about what does it mean then to be late to talk? And again, there are some differing definitions, generally based on monolingual children. But because, let's say, if a child has a language difficulty, it's not caused by the being multilingual. I think it's okay to look at these time frames. So children between 18 and 35 months, for example, who do understand what the parents are saying to them, but have, just seen a spelling mistake there, have restricted expressive vocabulary. So they're not saying a lot. They're not using a lot of words, or they're not combining words together into phrases. It's about, again, depending on where you read, about 15% of children, but, not set in stone. Or another definition would be a child who is 24 months old and is not using 50 words or using 2-word combinations. Things that put children at risk of being late to talk would be, for example, if they were born prematurely or low birth weight, for example, if there's a family history of speech and language difficulties. But just because I suppose you have risk factors, it doesn't mean the child is going to be necessarily delayed. When we're thinking about vocabulary, we need to think about all the languages the child speaks. And there are checklists for parents in lots of different languages where you can track their vocabulary development across all their languages. And there's also an instrument called the language use inventory, because checklists just tell you the vocabulary the child has, but they don't tell you how do they use them. And obviously how they use them to communicate is really important. For late talking, we're talking where everything else is proceeding along expected lines, so the child doesn't have a hearing difficulty, or they don't have, let's say, Down syndrome, for example. And we need to think about, is their understanding affected? Do they have kind of a mixture of they're late to talk in terms of the expression, but they also have trouble with comprehension? What's kind of typical development? What does the literature say? Between 18 and 20 months, at least 10 words in total. And then they talk about children learning, 10 words maybe per month, and this vocabulary spurt between 17 and 20 months, but not every child goes through it. I would say I have a little girl, she's 11 now, and I don't think she went through a vocabulary spurt. And I wrote down lots of what she was saying. I don't remember seeing that. And just to give you an idea in terms of the variation, so a boy's expressive vocabulary can range from 79 to 511 words at 24 months of age. So you can see the kind of the challenge for the speech and language therapist of working out who is having trouble, who needs help now, or who may grow out of it. So what can parents do to help? So basically, I think it's important to talk to a speech and language therapist to see, does the speech therapist think, oh yeah, it would be a good idea to have your child assessed now? We can assess children from 8 months and earlier. And we have tools like to do that reliably for multilingual children. And we are the professionals qualified to assess, diagnose, and plan intervention with you. I think that's a key point there, is planning intervention together with the family and working out what's important to them, what do they want, and working together to how to help that happen. Watching and waiting would have been an approach for children who are considered maybe late to talk, and the consensus now is that that isn't helpful, because early intervention is important and early intervention works. And your child might need to have their hearing tested. So when to see the SLT, and again, countries will vary too in terms of when a child can access services. So I'm aware of that. But let's say, for example, in Canada, the Hannon Centre recommend that if your child is 18 months and not using at least 20 words across the languages and different types of words, they should see the SLT. That's an important point about different types of words, because they need nouns and verbs, we'll say, to put two words together to say, let's say, want cake, for example. So when you're talking to your child, that you focus on using different types of words, so like prepositions or describing words or social words, for example, because they need those different word types in order to make phrases. If your child is 24 months, not using at least 100 words across all of their languages and combining words together, original word combinations, so it's things like thank you and what's that tend to be learned as a chunk. So it would be something like, mama gone, or dirty plate, or want more, for example. So what you can do is just take note of what your child is saying and the different kinds of words that they're using. So let's say if you have children then who are late to talk, and what happens, do they grow out of it? And basically what the research shows, it's positive really in the sense that it says that by 3 years of age, between 50 to 70% of late talkers could score on the typical range on vocabulary measures. So that's just one measure. But by 3 years of age, you're talking 50 to 70% are on the right track in terms of having caught up, we'll say, language-wise. And then by school age, they say again, 50-70% of late talkers would score in the normal or typical range for grammar and conversation skills by school age. So there's a phrase for late bloomers, the children who grow out of it. But what's interesting is that even children who catch up and the kind of delay resolves, when they're tested on language, like later in school, would say, for example, that they tend to score at the lower end of the average range compared to children who never were seen to be having like a language delay, for example. So it is hard for us to know who will grow out of it or who will go on to have persistent problems with language. The outcomes language-wise tend to be poorer if the child has a mixture of comprehension and expression together. So you see the importance of looking at what is the child understanding, not just what are they saying. Children who don't use gestures to communicate, that can be kind of an indicator as well that the outcome might be poorer, and if they don't imitate body movements, because imitation is an important part of language learning as well. If the child still has problems at the age of 5 and over, that's kind of indicative that they will continue to have persisting language problems and require speech and language therapy. I've talked briefly about the risk factors, and I'm just conscious of the time now, so I'm just going to skip through that. We can identify reliably language delay at 24 months. I would say it's never too early for the referral because of the waiting list problem. And let's say where I live, I think there are like assessments maybe 4 times a year. So timing is kind of key. And I think you'd be better off to be referred and not need it than to need the referral and then to be sitting on a waiting list, because early identification of issues is important because it does work. What will SLT be like then if you're going to see the speech and language therapist? And I would be hoping it would be a very positive experience and that you would meet a culturally sensitive speech and language therapist. We don't need to speak the same language as the family. We need to be culturally sensitive though, and collaborative and willing to let go of the expert role in some respects, in terms of like knowing about the other languages and knowing obviously about the family situation and what the family needs. So really, I would be promoting a kind of a collaborative approach. So part of the job of the speech and language therapist is to do their homework about, well, what are the characteristics of the grammar, let's say, of Russian versus English, and what are the speech sounds that may be in one language that aren't in the other, or what speech sounds are common to the languages, for example. Do I need to include extended family members in my assessment? Do I need to recruit an interpreter, for example? So in terms of the assessment, I've kind of talked about what you might expect there, and I'm nearly finished, and time for questions. And for infants and toddlers, really, parents are the key, and extended family members, depending on the situation, would be key participants. And a lot of what we would do at that age, we wouldn't be working directly with the child themselves. It would be through the parents, family members, and a lot of it would be parent training or extended family member training, where we would talk about strategies that are known to help language to develop. So for example, it might be something like, if your child is using one word, that then you use a short phrase, so you model 2 words together, we'll say, for instance. And again, you see a lot of the interventions for infants and toddlers who are late to talk are from the white Western perspective, so they're quite individualistic, but there are lots of tweaks we can do to make things more culturally sensitive. So for example, having a group of parents come for training where the parents share a language. So that might be, let's say, I'm thinking of situations in Ireland where you might have groups of Polish speaking parents come together, where the therapist then experiences being in the minority from a language point of view, and the parents can explain things to each other and support each other. And then they're also getting to meet people who speak the same language as them. So that's kind of something we can do to make things more culturally sensitive. Just in terms of the resources for you, so those are the links to the IELTS common questions, and it's available in a range of languages there. There's another really good website called the Before First Words Project, and that's about all sorts of things that happen before children begin to speak, not just the communication intentions that we talked about. And there's some lovely videos and stuff that I think it's really worth checking out. The First Words Project, that's Amy Weatherby, also worth checking out for the 16 gestures by 16 months, 16 actions on objects, also very good. Again, to just give you an idea of where to kind of expect your child to go, but bearing in mind it mightn't match your culture. So just to be aware of that. And then this is from a Canadian organization, and they are early language stimulation ideas available in a wide range of languages. So the link is there. And then my website, talklua.com, where I share evidence-based information about speech and language therapy for multilingual children. And coming soon is my book that will be out in January. And that basically is bringing all the kind of speech and language therapy stuff together about language development in speech and language development in multilingual children. What are the kind of challenges or problems that children can experience, and what you can do about it. So if you want to sign up for to find out when it's ready, I'd love to see you at talklua.com. So thank you very much for listening, and I look forward to answering your questions now.
Thank you so much, Mary Pat. That was a fantastic presentation with so much information. And we have many questions. We have about 8 minutes to answer answer a few questions, and I'll go from top to bottom here. And I have one from Simona, who's got a 3-year-old who is learning 3 languages, 1 minority language, and English and French as the majority languages. His elective language was French at first, and then he switched to English around the age of 2. His vocabulary acquisition stagnated for about 4 months. As a result, he displays a language development delay, even though we noticed a significant improvement in the last 2 months since the beginning of school. The therapist didn't find any development disorder. However, his teacher finds he might have Asperger's disorder. He shies away from communicating in English in school. How to respond to these concerns? Also, is it favorable for his language development to hear his family members switch between these 3 languages in conversation?
Okay, so right, I'll answer the last bit first. So with the mixing and the switching, okay, so people have different opinions on this, right? And basically, multilingual people mix and switch their languages. My understanding of the research is that children tend to mix and switch to the degree to which they hear it around them, although everyone's experience doesn't, match that. It's not a sign of disorder. It can be a sign of signaling identity. It can be, I do it myself if I'm speaking Irish and I can't think of the word in Irish, I'll just put in the English word when I know the person that I'm talking to has both languages. Yeah, and I think as well, like the literature would say that children need to learn the rules of mixing and switching. So that would be kind of in the realm of pragmatics, and that they learn, it tends to happen, mixing and switching in informal situations, and children are adept at learning when they can and can't, when it's kind of acceptable to switch or not to switch. So I wouldn't worry personally about the mixing and switching. If you were worried about it, there were 2 activities that lend themselves naturally to being in one language, and that's sharing books together or looking at books together, reading together, and singing songs, if you were worried about that. In relation to Asperger's, I would be saying now, how long is this child in school? Like, and aren't we all kind of, how would I say, maybe a little hesitant in an unfamiliar environment? I have to say, even this evening, I haven't done a Zoom call in a while. I couldn't see anyone. And I was listening to myself going, I don't sound like I usually sound. I feel nervous.
You sounded perfect, Mary Pat. Thank you very much. Thank you very much for that answer.
Okay.
So let's move to the next one. So Sarah Scully is interested in connecting with you. So your contact details will be on talknua.com, and you can contact her by there. Great. And then Jeff Sandstrom asks, can multilingualism cause a child to stutter, or does it make them more likely to stutter if they're prone to it?
Oh, now that's a very good question, and you won't believe it, but I actually was just reading there a few days ago a new study kind of pulling together all the research about multilingual children who stutter. I actually don't know the answer. However, I would be inclined to say that it really boils down to the languages the child needs. So that's really important, and that we'd never say drop a language. So actually, I don't know, but I am very happy to find out, and I will be posting. I have a couple of blog posts on Talk Nua about that, where I've gone into the research in more detail, and I will update with that new study. There's lots of gaps in the research, I think, is the main finding, really.
Chris asked, but she can have a link to those, and you put a post up, and there is already some stuff on your website. So yeah, we will close this soon. So maybe you can put it in the lobby. Any links that you have, Mary Pat, put them in the lobby rather than here, because we will be closing this soon.
Oh, that's fine, no problem.
Yes. So Sarah asked, he's got a 15-month-old who makes mostly says mama and dada or baba, make lots of sounds and random words in only one of his languages. And she's raising him in 5 languages: Mandarin, French, Spanish, Arabic, and English. And she's starting to feel concerned that she doesn't have an idea and that she's messing him up.
I think what I would say in that case is the main thing really is to see how progress. I suppose one thing is you need to think as well, how much exposure is the child getting to the different languages, and how much opportunity does he or she have to use their different languages? That's going to affect like the output, what the child is using. Again, I'd be interested in communication. What is a child interested in communicating about, wanting to communicate about? I would accept all communication attempts. And then I would kind of write down so you can get a bit more specific about what is he communicating about and what is he saying. But I'd be thinking about, the amount of exposure in all of the languages and the opportunities to use them.
Fantastic. Marisa is asking about how a therapist who doesn't know a child's language can actually do that. I think you have something on your website about that as well.
I do, but collaborating with the parents, critical.
And then collaborating with other speech and language therapists maybe as well, if it's possible.
Absolutely. And interpreters or maybe community leaders for the language. Yeah.
Mm-hmm. Ali Skogren says that she's never heard of the 16 gestures by 16 months. But if a 16-month-old is meeting other language milestones, for example, has 50 words already, but is missing some of the gestures, should the therapist then focus on the gestures that have been missed?
I don't know. I mean, if there isn't a problem, why would you go focusing on them? Yeah. Would be my kind of response to that.
If a child already kind of exceeds the 50 words, but
if they're communicating, it's more, I suppose the point I was trying to make was that we need to think prior to first words.
Absolutely. And thank you for repeatedly making it clear that this is different with different cultures and different languages. So it's not one-to-one. Maybe there are no gestures used in that family. So absolutely. Where would that child learn it? So absolutely. Okay, I think we have one more question and then we'll have to finish that. Okay. Thank you so much. I mean, this was so important information and thank you for presenting it in such a lovely way so we could learn a lot. So Monica asks, another five language family, 22 months old, 5 languages, Spanish, Arabic and French at home, Basque and English at school. She says no more than 5 words, but she understands everything and expresses herself with perfect signs.
Okay. So a 22-month-old.
22-month-old, yes.
Yeah, I mean, I see. The other thing is I'm a speech and language therapist, so my default is going to be see the speech and language therapist. So in that case, I think I would be saying it's no harm to find out what your local services, what's available, and be seen by speech. It's better to be seen and be told no, everything's fine, and than to kind of be worried and leave it. So I'd be saying in that case, maybe no harm to see the speech and language therapist.
Absolutely, and that's kind of for a peace of mind for parents as well. Well, I absolutely agree with that. Rather ask and have it get an answer than not ask and then maybe find out later that you should have been going earlier. So thank you very much. I think those are the questions we had time for. This has been recorded, so anyone who might want to rewatch, because Mary Pat is quite a fast speaker.
Sorry.
No, it's fine. No, you got so much information in, so this is perfect. Thank you very much. Okay. So now please join the lobby. We will be closing this, and then we'll have some Estonian coming next. Thank you very much, Mary Pat.
Thanks a million, and thank you, everybody.